With respect to COVID-19, Massachusetts continues to see extremely high levels of positive tests across the Commonwealth. All the data continues to indicate that the days and weeks ahead will be difficult ones. They're going to be difficult on our frontline medical workers as we expect hospitals to see more COVID patients. They're going to be difficult on our first responders who are likely to see an uptick in emergency response calls. And this will continue to be a difficult period for people who are out of work and for everyone who is doing the right thing by staying home. This hasn't been easy, but across the state, people have stepped up, adapted to these trying times, and are doing their part to stop the spread of the disease. The command center we launched and every branch of state government is also stepping up, so Massachusetts can respond to this emergency with every possible resource. I want to give a couple of updates here. First, on mobile testing, which is a program we put in place 2 weeks ago working with the Massachusetts National Guard and the Broad Institute. This effort provides on-site testing at long-term care facilities. Last week, the program was expanded to include assisted living residences and Department of Developmental Services group homes, including Rentham and Hogan. Since we launched this initiative on March 31st, more than 3,700 on-site tests have been collected at more than 220 facilities. In addition, facilities with trained clinical staff can now conduct their own testing by ordering test kits through the state's mobile testing program. As of this weekend, another 35 facilities have made requests, and we've sent almost 4,500 tests to them to be used. We'll continue to learn and adapt our approach to support these critical facilities and the people who live and work there as we move forward. As COVID-19 continues to impact our communities statewide, some places are getting hit harder than others. In the last few days, our command center has been working directly with the City of Chelsea and with City Manager Tom Ambrosino. Several state agencies are ready to provide resources that they've identified. Working with partners in Mass General Hospital, we have now increased testing capacity fourfold in the Chelsea area. In partnership with the city and the Salvation Army, MEMA is implementing a food plan to increase food kits from 100 a week to 750 a week by the end of this week. There are about 35 meals in one of those food kits, so 750 kits translates into about 26,000 meals. The Mass National Guard will play a key role in providing logistical support and delivery of these products. For individuals who are homeless and who have tested positive for COVID-19 in Chelsea, the command center is helping to set up an isolation hotel. And for individuals who test positive and are unable to stay with their family due to density issues, the command center and MEMA have also provided technical assistance and support to both Chelsea and Revere to access isolation capacity at the Quality Inn there. MEMA is providing supplies to set up the hotel, like linens and PPE, and will begin providing food services when the hotel opens. Working with MEMA, the command center is also contracting for an additional 50 beds at the Quality Inn to plan for potential overflow, which can be used if necessary. You've heard us say many times that it's a constant battle to get PPE, personal protective equipment, in the door to support our frontline healthcare workers and to protect patients from COVID-19. Yesterday, the command center posted a PPE distribution summary online, which will be updated regularly, that describes the kind of personal protective equipment that has been distributed across the state and where it's been distributed to. That includes over 360,000 aircraft masks, over 700,000 masks, 160,000 gowns, and almost 2 million gloves. This PPE has gone to nursing homes, hospitals, health centers, local public safety, boards of health, and other healthcare facilities across the Commonwealth. We also received the additional 200 ventilators from FEMA, which are now being examined and will be distributed starting later today or tomorrow morning. And we continue to work with a variety of supply chains, but we've also looked into our own businesses right here in Massachusetts to help us produce life-saving gear and supplies.